Okay, let's get started. I apologize for the late start. My tripod broke. It broke. It broke into pieces. As I was starting like this, as you see, I had like several false starts. My tripod broke. So I had to go, improvise. So this is a little this is like different from the usual, but we'll make it work. We'll do what we can. All right. Good morning, everybody. Thank you for joining me. Welcome to Health Talk with Dr. Mutiat. I am Dr. Mutiat Sunshine, a board certified nurse practitioner, and welcome. All right. So today we are going to talk about age appropriate screening. You know what brought this topic up is I was listening to a podcast yesterday, Trevor Noah's podcast with Halle Berry. And Halle Berry alluded to something that most of their doctors don't don't give them like a heads up of what's going to happen to them in the future. Do not tell them what's going to happen. They don't give them like education. And it kind of stung. It stung as a healthcare professional. Well, while I understand where she's coming from, also the way healthcare is regulated in the United States and in most places, we have little time to cover a lot. And unfortunately, some things get left behind. So that's one of the reasons why this show, on my free time, I can do this show and I can talk to a lot of people and we can get adequate, proper information out there. And this is why I also ask you to please make sure you share this video so a lot of people can get information that they may not necessarily be able to get from their primary care providers. So this is why we do this. Please, if you're watching this, please do me a favor, share this with your loved ones, share with your family, make sure you subscribe, and so we can bring more people in and people can get more information. That's all I ask. All right. Age appropriate screening. All right. Age appropriate screening. At every stage in your life, at every age in your life, there are some tests that you need to get done. Nobody is immune to diseases and illnesses that may occur. I've always said this, and I'll always keep saying this, but know your family history. Look at the people that have come before you, your father, your mother, your uncle, your aunt, anyone that's blood related to you. Now, I understand there are families that, they're not blood related. I understand people that have been adopted. That I understand. But anybody that's blood related to you, you need to look forward and see what is going on in their life, because there's a good chance it may happen to you and you may pass it on to your future generations. All right. So every age, at every stage in your life, please understand there's some screenings that we need to do to keep disease away from us. I know a lot of us do not do wellness visits. We wait till something is wrong before we go see doctors. That's not how it's supposed to be. You're supposed to see your doctors often. They're supposed to run tests. I liken this to generators and cars in Nigeria. You take your car in for oil change. You take your generator in for servicing. Why don't you take yourself in for servicing? Your own body. You need to take your body in for servicing. All right. So this is why we do this. All right. So at age 18, I'm an adult specialist. I don't specialize in children, but you take your children to their doctor, their pediatrician often to get their vaccinations, to do their age appropriate tests. And at that point, their pediatrician will do age appropriate tests for them. I'm not versed in that field. If you need me to do a talk on that field, I will have to research and get back to you. But I'm going to focus on adults only for this video. All right. Adults from age 18 to you die. 18 and older, you should have your blood pressure checked often. You should have your blood pressure checked often. And there's a method to checking blood pressure. You just don't take blood pressure all willing and nilly. You don't run 10 miles and come and sit down and take your blood pressure. You don't know. There's a method to checking your blood pressure. All right. So you need to have your blood pressure checked often. The regular blood pressure for everybody, regular accepted blood pressure is 120/80. Now, I'm not saying if you're 121/81, you have high blood pressure. And I'm not saying if you're 119/79, you have hypotension. No, each body is different. But as long as you stay in the range of 120/80, we are good. All right. Some people live at 110. I live at like 115-ish. That's where my blood pressure range, 115/80. That's where I am. So some people are like 122, 124/80, something like that. So as long as you know what your range is, that's what we stay by. All right. Make sure you check your blood pressure often. You can have your own blood pressure machine. It's the best blood pressure machines are the one that is taken on your arm. Yes, the wrist one is good, but it's prone to misread, and you have to take it and put it over your chest. There's a method to that one. So I really don't recommend the wrist one. I mostly recommend the arm one. All right. Electronic one, make sure your arm is down and you're relaxed and you're sitting up. Your legs are uncrossed. Hi, Toby. How are you? Thank you for joining. Your legs are uncrossed and you have your arm rested, and you check your blood pressure. You check your blood pressure at the same time every day and you write it down. All right. I'm not saying it's set in stone that you have to take your blood pressure at 10 o'clock every day, but take it around that time if you want to know what your range is. And let's say we take a week of blood pressure and you write it down, and that's where you get your average and you know where you live in your blood pressure. All right. Another test we need to get done from age 20 and above. From age 20. Remember, blood pressure is age 18. So when you go do that at age 20 and above, you need to also check your cholesterol. You need to check. Yeah, you can't be like, oh, I'm only 20 years old, I don't have cholesterol. Easy lie. Easy lie, easy lie. You may have high cholesterol. So you need to get it checked. You need to have your cholesterol checked with a yearly physical. You need to go for a yearly physical. These are the tests that your doctor will do at your yearly physical. You need to get them checked. You need to check, make sure you don't have cholesterol, and cholesterol can be handled. We'll probably talk about that. Maybe that will be our next topic. Let me write that down. We'll talk about cholesterol because I'm running out of topics. I don't know. Every day it's difficult to come up with topics, and you guys won't send me topics that you want me to talk about. Let's write it down. High cholesterol. We'll discuss that next. All right. So your cholesterol may be high, anything above 200. Your doctor may either say start exercising and change your diet, or they will place you on medication for the rest of your life. They may, mommy, hi, my mommy is here. Hi, mommy. All right. So Miss Arike, thank you for joining. So cholesterol, like I said, when anything above 200, your doctor might tell you, oh yeah, either you change your lifestyle, you start exercising, you eat well, or you will be placed on medication for the rest of your life. And when I mean rest of your life, I mean rest of your life. You cannot come off it. You will not stop it. All right. Another thing we need to get checked from age 35 and above. Age 35 and above. You need to make sure you check for diabetes. All right. You got to go to your doctors. They will do a test called A1C, and they will check to see what your level is. Anything I think is above 6.5 is, pre-diabetes, and everything above 7 is diabetic. I always get the range wrong. My specialty is oncology. All right. So, but anything above 6.5, we have issues. Okay. So you need to go, when you go for your physical, your yearly physical, what are the 3 things I've talked about so far? Is there a machine to check the cholesterol? No, you need to go to a lab for that. Your doctor needs to send you to a lab, and they'll write the test they want you to do, and then you bring it. There's no machine to check cholesterol. All right. Good evening, Miss Ifoma, Miss Ogu. Thank you for joining. All right. So 3 things we've talked about that your doctor will check when you go for your yearly screening: your blood pressure, your cholesterol, your blood sugar. And when I'm saying checking your blood sugar, I'm not saying the fingerprint. There's a blood test that has to be done in the lab to check. We use it to check your amount of sugar in your blood in 3 months. It's called an A1C. So we check that and make sure that your blood sugar is good. All right. It's not only by checking your finger. It's a specialized blood test. I have a colleague that that's it. And thank you for bringing that up, Toby. It is not that all fat people have cholesterol. They're skinny people, very extremely skinny, tiny people that have high cholesterol, that have hypertension. All right. That may have diabetes. So it's not by weight. It's not by size. It's about genetics. It's about what's going on the inside. You can't be like, I'm skinny, I'm healthy. That's a lie. I've seen so many skinny people die. And I've seen many obese people as healthy as can be. Like, I've seen obese people that will check their cholesterol, their blood pressure, everything. Perfect. And I've seen skinny people that will check their blood pressure is like 180 over something. Like, bros, nah, how far? Or we check your cholesterol is like 300. Or we check your blood sugar, your A1C is like 10. And like, dude, and you think you're skinny because you're skinny, you're healthy. Please, it doesn't correlate. Skinny does not necessarily mean healthy, and fat or obese does not necessarily mean unhealthy. So what's going on inside is all that matters. So we've talked about checking your blood pressure. We've talked about checking your cholesterol, and we've also talked about checking your diabetes. Make sure you don't have diabetes. All right. Any questions so far? Please let me know if you have any questions. The next thing that we're going to talk about is HIV. Yearly, when you go for your screen, you need to check for HIV. I'm slim, but yeah, cholesterol's like, yep. Yes, Ms. Timotokwe, thank you for saying that. Yes. So cholesterol, so please exercise, eat well, and your cholesterol may be handled. If it's not, please don't be afraid to go on medications. And that's why these medications are created. All right. So next thing we're going to talk about is HIV. HIV. You need to get screened for HIV. You need to get tested and make sure you've not been exposed. Once a year, get it done. Now, I'm saying this, but even if you've been, let me say this, let me preface it with this. Let's say you were exposed today, you got stuck by a needle, you slept with someone with HIV, any kind of exposure, you were exposed today. If you do your test tomorrow, it may not show because you've not seroconverted. It may not show that you're positive. If you get exposed today, Sunday, and go for a test Monday, it may not show you have HIV. We have to wait 6 months to know because it takes that long to seroconvert. It takes that time for your blood and everything to convert for us to know. So either you get tested every 6 months, but if you know you've not been exposed, every year, make sure you get tested every year. All right. And once, God forbid, like if in the case that you become positive HIV, there are many treatment options out there. And people live long on HIV. It's not the end of the world. Unfortunately, we may have cuts to the medication, but you got to be extremely careful out there. Be extremely careful out there. All right. Another thing we need to check for is hepatitis C. Hepatitis C. It's in the blood. It's blood transmitted. So once you're checking for HIV, check for hepatitis also. All right. There's no finger prick test. You have to go see your doctor. They have to order the test and you go do the test and bring the result back to them, and so they can know what to do. All right. Are we understanding? Do we have any other questions? No. All right. Now, this is my specialty, oncology, cancer. There are some cancers that we have screening for. Not all cancers have screening, but there's some that you can screen against. Let's start with women. We've already talked about this. Cervical cancer. You need to go for your pap smears often. Age 21 to 29, pap smear every 3 years. Age 30 to 65, every 3 years. HPV test. We talked about HPV a couple of videos back. Every 5 years. All right. You need to go get those testing done. You can screen against cervical cancer. HPV, human papilloma virus. You need to screen against that to make sure you don't have it. Anybody can have HPV, man or woman. Anyone can have HPV, man or woman. You need to screen. In men, HPV may cause throat cancer. All right. It may cause oral cancer. So HPV can cause cancer in men and women. So you need to go and screen for HPV. All right. Next, my women. We need to do self-breast exams. I know there's literature out there that's saying it's not as effective anymore, but we are talking about to my people in Nigeria, because I know y'all don't go to doctors. So to my people, you need to check your breast every month. All right. You need to look up videos. If I post the video, Uncle Azuka will ban my video, because the last time I did testicular cancer screening, they banned my page. So I won't be showing you that because no verse. But go online and research and look for videos on how to do self-breast exams. And if you notice anything, go see your doctor immediately. Women over 40, I need to schedule my own mammogram. Women over 40, you need to get mammograms done. You need to get mammograms done every year to every 2 years. Women over 40, age 40 and above, women, make sure you schedule your mammogram. All you elders, I'm one of the elder. I'm an elder too. Thank you. Thank you very much. Even though my skin is skinning, thank you. Please make sure you get your mammogram done. Next thing, colorectal cancer. Colorectal cancer. It's recommended. Before it used to be age 50, but now we are bringing it down. Bring it down. Good evening to Dr. Mutiat. Biko no vex. Vexike. Why would I be vexing? All right. Colorectal cancer, we can screen against that also. How do we screen against that? Age 45, it's not 45, we do colonoscopy. You need to go get a colonoscopy done. I'm aging towards that age. Oh, Jesus. You need to get a colonoscopy done. All right, so your doctors need to look in your colon, look at them, make sure you don't have any polyps, any abnormal cells, and all that good stuff. And these things grow rapidly. If they grow rapidly, please, 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 if you're at age 45 or you notice anybody in your family has a history of any form of cancer, please make sure you're speaking to your primary care providers. Please make sure you're speaking to them so they can start screening you in advance. If you have a family history of cancer, your own case might be different depending on what cancer your family has. If you have a history, please make sure you're speaking to your doctors and they're testing you quickly. You can do a colorectal, you can do a colonoscopy. You can do, in the US, we have a fit testing that will take a sample of your stool and we send it to the lab to make sure there's no abnormal cells in there, things like that. So please, we've talked about breast cancer. We've talked about HPV and cervical cancer. We've talked about colorectal cancer. Next one, prostate cancer. My man, over 40. Men over 40, especially black men over 40. Nigerian men over 40. Please make sure you have gone to have your prostate checked. Please make sure you have gone to do what? To have your prostate check. You must have a prostate check done. We start with a blood test, and also your doctor will do a physical test to physically feel your prostate. Only men can do prostate checks. Women, we don't have prostates. We have cervical cancer. We need to do our own. Men, check a prostate. All right. So another thing we can screen for, lung cancer. Now, most people erroneously think that if you've never smoked, you will never have lung cancer. That's false. There are some people in their life that never touched a cigarette, but they end up having lung cancer. You need to go make sure you see your doctor. Especially if you're a smoker, age 50 and above, there's some testings that your doctors will do to screen you for lung cancer. That may need to be done. All right. Another thing we can talk about is for women over, I want to say 65 and above, bone density scan. Bone density scan. You need to check your bone density. And for us young people, we need to lift weights so our bones can remain strong. Our bones can remain strong. I hurt my back this past week, so I've not been lifting, but I miss lifting. I can't believe I'm saying that I miss exercising. I miss exercising. So I'm waiting for my body to straighten out, because one of my aburus just used my own logic against me that because you're feeling better, you're not giving yourself rest. You need to rest before you start lifting again. So I'm giving myself rest, but please make sure you are lifting. If you're under, now start lifting. And women, it won't make you bulky. Do I look bulky? I don't look bulky now. See? I don't look bulky. It doesn't make you bulky. It just makes your bones strong. Makes you stronger. All right? All right. Now, another thing, a lot of people don't get checked. Their teeth. You need to make sure you're seeing a dentist at least once a year. It's the beginning of the year. I'm scheduling all my own preventive screening very soon. I'm going to be getting them done. I normally get it done at the beginning of the year. So, please make sure you get your teeth. Your teeth needs to be checked. You need to go see a dentist. You don't wait till when your teeth is hurting, when your mouth is hurting before you go see a dentist. I know I've said this before and I'll say it again. When you have infected teeth, sometimes it goes to your heart. Yeah, to your heart and gives the heart infection. So you got to make sure your teeth is strong and healthy. All right. Another thing you need to get checked, your eyes. Your eyes. Did you know that if you have diabetes, if you have hypertension, it can make you go blind? Diabetes, hypertension can make you go blind. Untreated diabetes and hypertension may hurt your vision. So if you don't go for your eyes check, you won't know that yes, your optometrist, optician, ophthalmology can know by testing if you have hypertension. They will let you know by when they look into your eyes. Yes, they can see all that in your eyes, the veins, the vessels, everything like that. Yeah, everything has a meaning. So you also have to make sure you go get your eye check every year. And if you use glasses, you need to check your glasses every year also. Your prescription may not be the same prescription this year. And I know people erroneously think glasses makes your eyes go worse. No, your eyes is going bad on its own. Glasses is not a cure. It's a corrective. It's not a cure for what's going on with your eyes. It's to correct. So you wear glasses to correct. Your eyes are going bad. Your eyes are going bad on its own, whether or not you wear glasses. It just makes you worse when you don't wear glasses. All right. So please make sure you're getting your eyes checked. Next, your hearing. Your hearing test for people over 50 and above. You got to make sure your ears are checked. Make sure your hearing is checked. I know by the time I age 50, my auditory person will be like, oh, more. Yes, because I blast music. I can't listen to music slowly. I blast it in my ear. So I know when I get to that age. All right. So, and that's all I have for you today. Do we have any questions? Do you really need to? Yes, Mr. Strike, you need to get your prostate checked. The test I did earlier is different from what Yep. Every year you need to make sure you check your eyes. You need to make sure your eyes are checked because your prescriptions are not going to be the same. All right. Do we have any questions before I let you guys go? I'm trying to be conservative with everybody's data so I don't burn your data. Please make sure you share this video. I want you to see share. Engage, invite people to join us. We are here. I'm here every Sunday at 6 p.m. Nigerian time. Today I had a little prostate cancer. I've been to few awareness and free cancer testing session. You will have 2 to 4 men among 50 men. Exactly. Please encourage our women to, yes, please. You know what? I'm going to encourage both of the couple. Men, please make sure your wives are getting their screening done. Wives, please make sure your husbands are getting their screening done. Both of you encourage each other for you to live longer. My husband is tired of me because I'm always on him. You need to get this done. You need to get that done. And he goes to get it done. I tell him what he needs to get done because I need him to be here with me forever. He cannot leave me. He cannot. So I got to do everything in my power to make sure my husband is there with me for a long time. And my mom too, I always tell her, because I want her to be with me for a long time. Okay? So can you test? You can check diabetes. Thank you. Oh my God, Miss Ogu. Bravo. Well done. Thank you for that quick recap. Look at you. Well done. I appreciate that. Thank you. So please, all those tests, we need to get it done. Please make sure we get all these tests done to screen, to make sure you're healthy. You take your generator in for servicing. You take your car in for servicing. Take yourself in for servicing as well, because it is good for you. It's good for your body. It's good for your mind. All right. Oh, I forgot to say mental health. Yes, mental health. Please make sure you're checking in with your mental health professional. Unfortunately, I am not a mental health professional. I wish I was. I don't have the patience. God did not bless me with that kind of patience. So, but please make sure you're checking in with yourself mentally and making sure you're doing everything you can to maintain your sanity. I know the world is going to help. It's like just doing what it wants to do, but you got to do everything to protect your own sanity. If you need to detach. Whatever you need to do to make sure your sanity is safe, please make sure you're doing that. All right. So, and I think that is all. Let me see if I have any more questions. No questions in here. It's been a pleasure as usual. Please, I'll be back again next week, Sunday at 6 p.m. Nigerian time, 11 a.m. if they've not changed the time, Houston time. But I'm here 6 p.m. Nigerian time standard. All right. So that would not change. If you have any questions, please feel free to slide into my inbox with your questions. I'm going to answer them. All I ask is you get to the questions quickly. Don't say hi and expect me to respond and wait for me. No, just get to the point. So when I have a free moment, I can quickly respond to your questions. Please don't forget to share, like, subscribe, invite your friends and family. Please do not gatekeep me. I am not here to be gatekeeping. Gates, whatever. Or, you know, share with everybody. Let everybody learn. My mission is to make sure that we have health information. And I will say this before I end, like, this is not the end all be all. Everything that I've asked you to do, do not do it by yourself. You need to go see your primary care provider, your medical doctor, your nurse practitioner, whoever delivers your care, and you sit with them and let them determine which tests you need to get done and do it appropriately according to you and your medical history. So this is not an end all be all. Everything I'm giving here is for informational purposes only. Informational purposes only. Please make sure you understand that. All right. Dr. Sunshine, Dr. Mutiat, Dr. OG, whatever you'd like to call me, I am signing off. Is there a permanent cure for battling cysts? Yeah, that's a question a gynecologist can answer. Unfortunately, I'm not a gynecologist. I cannot answer that for you. But what I'm thinking in my head, you may not want to hear. All right. We'll talk about that offline. All righty. Thank you. It's been a pleasure. Dr. Mutiat signing off. Bye-bye. Take care of yourself.